Most women have no idea that fractures are a leading cause of death. In fact, the 2-year mortality rate for a hip fracture in a woman who's not on hormones is close to 50%. Unfortunately, many women are walking around with bone loss and have no idea simply because they haven't been tested for it. In fact, doctors don't recommend bone density testing in women until they've reached 55 years old, because that's when insurance covers it. In my opinion, every woman should have a DEXA scan done, and I do one on every single patient that walks in my office, regardless of their age. I have seen dozens of women in their 30s and 40s with bone loss that can easily be reversed by following these 3 steps. Step 1 is to optimize your vitamin D levels, which the science says is in the 50 to 80 range in the blood. Step 2 is to correct any hormone deficiencies. The hormones that play the largest role in bone metabolism are estradiol, testosterone, and growth hormone. Step 3 is to incorporate strength training into your workout routine. When you build muscle, the bone will follow. I have successfully reversed bone loss in my female patients using these 3 steps.